Good evening. A warm welcome to MP's Young Patient Group webinar on myeloma and physical fitness. I'm Linda Christopher, the head of member and patient community programs at MP, and I will be moderating the webinar today. Next slide, please. A quick overview of the agenda. So I will give you all some housekeeping instructions and introduce the speaker and the webinar, followed by which we have our speaker who will do a 35-minute presentation on the topic, after which we will have a quick round of question and answer session. Next slide, please. Okay. A couple of housekeeping instructions. So you should be able to see and hear the presenter, but you will not be able to see and hear other attendees. If you cannot hear the presenter, make sure your speaker are not muted and that your volume is set on high. There will be a question and answer session with the presenter at the end of the presentation. So please use the Q&A box at the bottom of your screen to post any questions that you have for the presenter. Next slide, please. You can also use the chat window to chat with other participants to share your experience or comment on the current discussion, but kindly use only the Q&A box to post any questions that you have for the presenter. If you're having any trouble with poor video or signal cutting in and out, consider attending in audio mode only. And if you're facing any technical difficulties, please let us know in the chat box and someone from the MPE team will help you with it. This webinar is recorded and it will be available on our website and social media page by the end of this week. Next slide. So for those of you who are new, I would like to quickly introduce the European Young Myeloma Patients Group. So the European Young Myeloma Patient Group was started and it aims to address the unmet need of young myeloma patients, and it also provides a forum, a platform to discuss challenges and topics that are important to this patient population. And a couple of things that we do as part of this group is once every quarter, we organize a webinar, and the topic for discussion is selected by the group members that are very important to them. And there is also a Facebook support group. And if you're not already part of the group, we encourage you to sign up so that you could meet with other young patients and share your experience and lean on for any kind of support that you need. And again, this group is for patients who are 55 or younger. Thanks. Next slide, please. Okay, and I'm very happy to introduce the speaker for today. It's Anna Bernardino, and she's a PhD scholar in human motricity at the Faculty of Human Kinetics at the University of Lisbon. She holds an MSc in Exercise and Health. In addition to her academic work, Anna also collaborates as an exercise physiologist at MP's member organization APCL in Portugal, where she applies her expertise to support patients undergoing cancer treatment. We're very happy to have Anna. Thank you so much, Anna, for accepting our invitation and for doing this webinar for us. I hand over to Anna for the presentation. And again, if you have any questions for Anna, please use the Q&A box at the bottom of your screen to post your questions, and they will be answered after Anna's presentation. Over to you, Anna.
Okay. Hello, everyone. I think you are already seeing my presentation, so I'm going to start. As Linda said, my name is Anna, and I'm an exercise physiologist currently doing my PhD in exercise oncology. Today, I'm here to talk about the benefits of exercise in myeloma patients. So these are some of the topics that I'm going to cover throughout this session, and we're going to start talking about the common symptoms and side effects experienced by myeloma patients. As we know, cancer treatments have been improving over the years, extending the overall survival for myeloma patients. New treatment approaches implies that patients need to learn how to live and perform daily living activities with cumulative side effects. Some common side effects experienced by myeloma patients include fatigue, gastrointestinal alterations, body composition alterations, increased risk of infection, osteolytic bone disease, decreased physical fitness, and peripheric neuropathy, all of this contributing to a decrease in quality of life. Physical exercise has been proposed as an ally during and after the cancer treatments. However, health professionals and cancer patients themselves often have some doubts about whether it is actually safe and feasible to exercise during these critical periods. So to address this concern, in this randomized controlled trial, 59 patients with multiple myeloma at different stages of the disease were enrolled in either a control group with a waiting list or an intervention group. The intervention consisted of a 12-week exercise program during which patients underwent through 2 weekly supervised sessions in a gymnasium by an exercise physiologist and a weekly home-based unsupervised sessions. This exercise program was a combined program, which means it had an aerobic part and a resistance training part. During the 12-week period, no exercise-related adverse events occurred during or between the sessions. And additionally, despite there was a high incidence of bone disease and the inclusion of high-intensity and impact exercises in the protocol, no patients experienced pathological fractures during the exercise sessions. Another aspect that is important to highlight is the fact that attendance rates were higher in the supervised sessions compared to the unsupervised ones at home, which may emphasize the importance of supervision for patients in terms of feeling safe while exercising. It is also important to emphasize two key messages that the authors from this paper said. The first one is that it is important to consider the baseline capacity of each patient and consider the possible slower rates of progression in this population for exercise programs. And the second one is that it is safe and feasible to engage in exercise, and I think it's really important to mention that even high interval training and moderate to vigorous intensity resistance training are safe to perform with proper supervision and individualization of exercise programs by exercise physiologists. Now that we address the safety concerns, let's focus our attention on exercise benefits in cancer patients. Evidence has been showing that exercise has several benefits in cancer patients, such as reducing cancer-related fatigue, increasing physical fitness, increasing bone health, cardiovascular health, improving body composition, and so improving quality of life. Now let's focus on each of them individually. So let's start with cancer-related fatigue. This is one of the most common side effects that cancer patients experience either during the treatments and often can persist even years after the treatment is concluded. It's very common for this population to fall into the vicious cycle of fatigue. And what does this mean? It means that the greater the perception of fatigue a patient have, the more inactive the patient will tend to be, and more time they will spend in sedentary behavior. And this goes on and on. However, it is possible to break this cycle using physical exercise, which works by increasing physical fitness and decreasing systemic inflammation, and thus helping to reduce cancer-related fatigue. In fact, in this research that evaluated the effects of an exercise intervention in fatigue, quality of life, and physical fitness following an exercise interventions, it was stated that, in fact, the patients reported that exercise promoted improvements in perceived fatigue after the intervention. Now, focusing on physical fitness, First, I want to address what is physical fitness. Physical fitness includes not only cardiorespiratory fitness and muscle strength, but also body composition and flexibility, although we are going to address body composition later on the presentation. Due to the disease itself and to the cancer treatment, physical fitness is generally reduced in cancer patients, which contributes to a decrease in physical independence. This systematic review analyzed the effects of exercise on cancer patients during the neoadjuvant treatment, and the main conclusions are that exercise can help preserve and maintain and increase, cardiorespiratory fitness, muscle strength, and body composition during treatments. Since cancer treatments have a very debilitating effect on these patients, it is extremely important to emphasize the role of exercise in maintaining or preserving these physical fitness levels. Regarding the study I was mentioned before, I want you to look at the tables on the laptop and see that the authors only concluded that regarding physical fitness, there was a statistical significance in improving leg muscle strength, both at 3 and 6 months. However, we can see if we look at muscle mass, peak oxygen consumption, and grip strength, which is considered a global indicator of muscle strength, there was also slight increases after the exercise intervention, although not statistically significant, which is important regarding the preserving the physical fitness and not just improving them. So, regarding bone health, and as I said before, bone mineral density is severely affected by cancer treatments, increasing the risk of osteoporosis. Additionally, osteolytic bone disease, as I mentioned, is a very common side effect in patients with multiple myeloma. Both of these, osteolytic bone disease and osteoporosis, contribute to an increased risk of pathological fractures, and physical exercise has a role in improving and preventing the loss of bone mineral density in patients with cancer. I hope I'm not talking too fast. If I am, I'm sorry. So, moving on to cardiovascular health. Cancer is also associated with a higher risk of developing cardiovascular diseases such as heart failure and coronary heart disease. Exercise makes it possible to preserve or increase the cardiorespiratory fitness of patients with cancer, which is very important since better cardiorespiratory fitness is associated with a reduction in the risk of developing cardiovascular diseases, a reduction in all-cause mortality and cancer-related mortality, and a reduction in morbidity. As I mentioned before, another physical fitness component that is really important is body composition, mainly muscle mass. Muscle mass is an extremely important component for people with cancer, not only because of functional independence, but also because it is associated with the toxicity associated with treatments. Physical exercise makes it possible to preserve and increase muscle mass in this population, thus contributing to a reduction in the toxicity associated with the treatments, and thus contributing to a reduction in the perceived side effects and an increase in treatment tolerance. All of these benefits that I have been talking about so far culminates in an improvement in one of the most important factors for people with cancer, which is an improvement in quality of life. Physical exercise has the potential to reduce fatigue, anxiety, and depressive symptoms, to reduce sleep disturbances, and to increase physical function, which culminate in an improved quality of life. However, a diagnosis of multiple myeloma has a negative impact on exercise levels, and the evidence shows that a low percentage of survivors exercise at the recommended levels. But now there's another question that we need to make, which is, what are these recommended levels? The World Health Organization and the American College of Sports Medicine recommends to achieve 150 to 300 minutes per week of moderate intensity aerobic exercise, or 75 to 150 minutes a week of vigorous intensity aerobic exercise, or a combination of these. Also, it is recommended to engage in at least 2 days a week of strength training with exercises for major muscle groups, and also engaging in at least 2 to 3 days a week of balance and flexibility exercises. These recommendations that you see on your screen are the same for apparently healthy population and cancer patients. However, there is only one thing that is added by the World Health Organization to cancer patients. And I think it's really important, is that it's not is more important than fulfilling the recommendations, is to avoid inactivity and to be as physically active as the disease and your condition allows you to be. There are some precautions we need to have when we are planning an exercise session, and we need to take into account some factors to prepare the exercise programs and to bring the greatest benefits to patients. Blood tests are one of these factors. It's important to take into account factors such as thrombocytopenia, neutropenia, and anemia, so that we can adapt the exercise sessions as best as possible to the patients. Based on these factors, we need to adjust the exercise intensity, duration, frequency, among other factors. For example, if we have a patient presenting neutropenia, maybe we should encourage him or her to engage in exercise home-based and supervised by us, obviously. We should prescribe light to moderate intensity exercise, but if the patient comes to us to a gym and to have a one-to-one session, we should clean the equipment before utilization and sanitize hands throughout the training to minimize the risk of infection. Another precaution that is really important to keep in mind is about bone pain. When a patient experiences bone pain, we should monitor the symptoms during and after the exercise sessions. And if during the exercise session if it gets worse, we should stop the exercise. It's also important to add the goal of preventing falls to the exercise program when patients present with the bone pain, because not fractures, falls play an important role in these pathological fractures. And if we spend some time of the session with exercises for the balance, it will help with the goal of preventing falls. In addition, it is also important to avoid certain contraindicated movements that could place high loads on fragile parts of the skeleton. But as I mentioned, it is always important to consider the person in front of you and not to standardize these things, because one exercise may not be ideal for the patient A, but for the patient B may not be contraindicated, and we should always focus on the person in front of us and in the symptoms he or she presents. Peripheral neuropathy if present, should also be monitored to exercise prescription. We should monitor it during and after exercise sessions. And for example, if it affects fit and consequently stability when prescribing aerobic exercise, and depending always on the context and on the equipment available, we can consider, for example, stationary exercise in a cycle ergometer. For example, instead of treadmills, or using a treadmill with safety handrails. With regard to resistance training, we should monitor discomfort when using held hands weights, and we could consider using dumbbells with soft coverings, for example, or considering using resistance machines instead of free weights, always depending on what the person is feeling in the session. The last precaution that I'd like to address is stem cell transplantation. According to the American College of Sports Medicine, when prescribing exercise to a patient who has undergone a stem cell transplant, the exercise should begin with a light intensity and short durations, but with a high frequency during the week, and progress slowly. However, the volume of the exercise must always be constantly monitored. Before returning to gyms, a complete recovery of the immune system is also recommended. However, patients are encouraged to exercise at home, so should be encouraged to exercise at home so that they can remain as active as their condition allows, as I mentioned when I address the recommendations factor, and always with supervision to minimize the loss of physical fitness and therefore to minimize the loss of physical function. There are several places that you can go to exercise that are specialized in oncology and in exercise oncology. For example, clinical gyms. We have an example here in Portugal that is in the Champalimaud Foundation. You can also attend group classes or online group classes, or even one-to-one online classes. For example, me, Professor Carlota, and Professor Sofia teach classes three days a week for the APCL, as Linda mentioned before. And finally, a place that I think we should start considering is the context of hospitalization. For example, there are growing evidence showing that it's safe and feasible to engage in exercise programs in a hospital setting. And since the time a patient spends at the hospital is variable, it can go from some days to weeks to months. And since the loss of muscle mass is very common during hospitalization, which is a very important component of body composition for all the reasons I mentioned earlier, exercise should be considered in these contexts. All right, so I think I'm talking a little bit fast, but this is one of the last topics that I want to address, which are the multidisciplinary teams. As I mentioned during my presentation, exercise is in fact a really important factor for myeloma patients, either during the treatment phase and after it has finished. However, exercise is not the golden pill. It's just one part of many that are important for patients' recovery and well-being. And that's why it's very important to work as a multidisciplinary team involving the medical team, nurses, physiotherapists, exercise physiologists, nutritionists, psychologists, among others, in order to achieve the greatest benefits possible for the myeloma patients. Some take-home messages that I want you to keep in mind. The first one, physical exercise is an important ally in managing disease and treatment-related symptoms and side effects. Second, more important than fulfilling the recommendations is avoiding inactivity and being as physically active as possible. The third one is that we should adjust and adapt the intensity and duration of exercise daily based on the patient's condition and perception. And the last one, it is important that healthcare professionals work in a multidisciplinary team to ensure that patients receive the greatest possible benefits. And thank you very much for your attention. Now I'm ready to answer the questions you may have or you may not have yet. And if you think of a question later, you can also always send me an email.
Thank you so much, Anna, for the great presentation. I'm sure we already do have a few questions, and I'm sure there will be more questions that will come because this is a very important topic for our patient group, and I'm sure they have a lot of questions to us. So the first question that we have here is, are there certain exercise or sport that patients should avoid in order to prevent injury? And I'm also going to combine that with another question. And what would be some of the sport that you would recommend, and why would you recommend those?
Okay. Just for the record, if I take a little bit longer to respond, is because I'm thinking and translating, okay?
No
Just for the
problem. Take your
audience to
time.
know. So regarding the exercise or sports that you should avoid, if you ask me if you can do Olympic gymnastics or maybe I will say no. But regarding other types of exercise, I think the best thing to do is always talk with an exercise physiologist to adapt the exercise program to yourself, because you can, and it's safe to go, no, the words. It's safe to engage in aerobic exercise, strength exercise, flexibility, balance, and you should address these types of programs. But as I mentioned, we can have a standardized program, but in that standardized program, we should always adapt everything to the patient that is in front of us and to the needs that he might have. For example, if we have a patient that has peripheral neuropathy, of course, we should take some time off the session to do balance exercises, for example. Can you please remind me the second part of the question, Linda, please?
I think you kind of covered it.
Okay.
Like basically the question was, what would you recommend and why you would recommend that? And I think you covered that. Thank you. So the next question is something that you did address as part of your presentation, but if you could maybe elaborate it a little bit more, it might be helpful. And the question is, could exercise support recovery and prolong life or improve quality of life?
Yes, in fact, exercise can definitely contribute to improve quality of life and survival among with the other treatments, because as I mentioned, it is not the golden pill. However, and taking it into account the several benefits that I mentioned, there's another one that it's related to the exercise that I want to address here, which is the social component, because the human being is a social, I'm forgetting the word, but I think you are understanding in the context of the phrase. And the fact that we talk with, I mean, the patient have the opportunity to talk with someone outside of their inner circle, like an exercise physiologist, is already good, because sometimes not, we can talk about the problems, but the person near us may not understand, but I think the group classes are also a very important part of the exercise, because being in a place or in an online class with people that understand what you are going through and that can help you with some tips regarding what you are going to right now or what can you expect may help you feel more relief and contributes to improving quality of life.
Thank you. So the next question is, are there different type of sports or exercise that is recommended before, during, and also after treatment?
I think before, during, and after the treatments, and patients should engage in exercise programs that combine both aerobic exercise, resistance training or strength training, flexibility, and balance. In fact, in my online classes, this is something that I try to do. I try to make some time for each component and combine so the patient can achieve the best outcomes possible, which is improving cardiorespiratory fitness and muscle strength to help him being more independent in the daily basis activities and to help him I'm trying to translate again, I'm sorry, to help him feel feel less the side effects from the treatments itself and from the disease.
Okay. And what about patients who have spinal surgery? Are there any recommendations for them in terms of what kind of sport that they could do?
I think we should analyze every patient as one case. What I mean is that every patient is different, and we need to take into account what the patient is feeling in every session, and we can start, for example, with the aerobic exercise, and even in the resistance exercise, we should progress slowly, and, for example, not start with external weights and start with body weight, for example, to build a home. Let's say when we build a home, we start by the
Foundation.
exactly, to build some foundation before we can step forward to other types of exercise.
Thank you. We have another interesting question. Are visits to sauna allowed?
All right, so regarding sauna, I think you should always contact your doctors to address this concern, because this is not my expertise, and I think the doctor will have the best solution for you.
Okay. Thank you for addressing that. I also want to quickly remind, if anyone has questions, please post it on the Q&A box. Unfortunately, I do see some hands raised. Unfortunately, we will not be able to take live Q&A. So if you could please post your question in the Q&A box, we could ask that to Anna. Thank you. Okay, the next question is, how can I increase my energy and stamina during and after treatment? It is a start from 0.
Okay, so after treatment, we can start with the light exercise, light intensity exercise, for example, with short durations but high frequency. What I mean is, instead of two weekly sessions, maybe 3, maybe 4, but less time in each session. and then slowly progress in the intensity and in the exercise duration, so you can improve your resistance after the treatments.
Mhm. Thank you. The next question is, it says on slide 15, maybe you could progress your slide to slide 15. You had suggested 3 types of exercise. And the question is, should we see them as alternatives, or rather all 3 should coexist?
All 3 should coexist because every step of this chain of exercise is important. There's not one that is more important than the others.
Okay. But in terms of the intensity, it might vary.
In terms of the intensity, can you please repeat, Linda, please?
Now, in terms of the intensity of these 3, it might vary depending on the condition of the patient,
Exactly.
right? Okay, thank you. The next question is, can HIIT exercise be a good substitute for weight training? Due to bone injuries, using weight is problematic for the person who has asked this question. So they want to know if HIIT exercise is a good substitute.
I don't think there is a good substitute per se, but if weights are a problem for you, maybe there is another options like the body weight itself, for example, that can help with these bone injuries problems. If I'm being, I don't know if you understand what I mean.
If you could explain it a little bit more, that would be helpful.
For example, if you have problem doing a squat
Mm-hmm.
with the external weights or with your body weight, we can adjust. I'm thinking of the squat, but could be another exercise. But this was the first one that popped in my mind. We can adjust for like, okay, instead of just squatting, let's sit on a chair and then get up and sit. I don't say you can't do it because it's always an option, but we can adjust the exercise types to better accommodate the problems you are facing.
Mm-hmm. Thank you. Okay. The next question is, can we have more concrete examples for recommended versus not recommended sports? Example, sports with balloon, team sports that engage the heart a lot, swimming, etc. So if you could give examples of what is recommended and what is not recommended for patients.
Okay, I can search a little more, but from my experience, I think the team sports like rugby, basketball, and for example, football, which involves a lot of contact between the participants, even though it's not supposed to, and that involve a risk of falling, may not be so recommended. I think the most recommended type of exercise you can undergo is the an exercise program that covers the all. What I mean is aerobic components, strength components, and balance and flexibility. But I can search a little more and send a greater answer to Linda after that, if you want to.
Okay, thank you. Okay. Is there somewhere we can find online videos with recommended exercise adapted to our treatment stage, or adapted to their physical fitness?
I don't think there is a platform for that. I think you should uh, talk with an exercise physiologist or try to see if in your country there is some association like we have in Portugal.
Like national patient
Yes,
organizations.
exactly. So that they can refer you to exercise physiologists that are working with them, for example.
Okay. So there is no like a app or
I don't
something
think
then.
so.
Okay.
I don't think so.
Okay. Good to know. Thank you. Okay. The next question is, how can swimming be incorporated into an exercise regime, and how frequent or how long for each session would you recommend?
If you don't have, I don't remember the name, but for the IV transfusions, infusions
Mm-hmm.
in Portugal, we say catheter. I don't remember the word. So the,
Yes.
well, if you don't have that kind of stuff, and if you don't have open scars or something, not scars, wounds, open wounds, I think swimming is safe. But I think you should always clear it with your doctor if it's safe for you to be in public pools, for example, because of the risk of infection. Depend how frequent and how long depends on the object, the goals that you have for each session. I think you should always. I think I'm saying every time the same thing. You should always address an exercise physiologist. I say this because it's really important to have some supervision, at least when you are learning or when you are in the beginning and don't know if the things that you are doing are correct or something. I think the frequency and the duration of each sessions should be adapted to each patient.
Mm-hmm. Okay, it's not like one size fits all, right?
Exactly.
Okay. Okay. Are protein supplements allowed, plus program activities or sports?
This is another question that it's a little bit off my expertise. I think you should talk to a nutritionist, for example, because of the supplement part. But if the nutritionist and your doctor gives you clearance for that, then I think it's allowed. But I think you should address them.
Okay. Can sports sessions be prescribed or reimbursed? How is this handled in various countries? I'm not sure that's something that you would be able to answer,
Yes, I
right?
think I cannot answer this. I'm sorry.
Yeah, so whoever asked this, we're sorry. This is something that would not be able to be answered now. The next question is, would something like walking football be suitable alternate to regular football? And would it fall under the 150 to 300 minutes of moderate intensity?
I would say that it could be suitable, yes, but always with some precaution, of course, because of the risk of falling and everything. And it definitely falls under the 150 to 30 minutes of moderate intensity.
Okay. And is Pilates a good substitute for weight training?
I don't see Pilates as a substitute, but also as a part of the exercise chain, let's say. I think it's an important part, yes. And I think it's, for example, I don't say a good start, but let's let's go with it. A good start and a good exercise program if you are not comfortable with weightlifting, for example. Weightlifting, of course, not the can't remember the words.
Like heavy and intense ones,
Exactly.
right? Okay. Okay, I think we have the last question. Um, What if there's no exercise physiologist in the country where a patient is? Who would be the alternate person that they could visit or get recommendations from?
That's a tricky one. I don't think there is another person other than an exercise physiologist to help you with the exercise matter. You can, for example, try to, if the schedule is compatible, try to talk with exercise physiologists from other countries, for example.
Okay. But like physiotherapist is not someone that they could get recommendations from.
Kinda. Physiotherapy is really important, but in not are the words. It can it can't I'm forgetting. Basically, what I want to say is that both exercise physiologists and physiotherapists have a really important role in the multidisciplinary team, but they can't uh, not do, but give recommendations about the both jobs. You know what I mean?
Okay.
I
One
think
cannot be substituted by another. Both of
exactly.
their roles are very important.
Exactly.
Okay. Okay. Oh, we do have it's not a question, but more of thank you for your presentation uh, from an attendee. Is there any other last final comments that you would have for our patients?
I think if you are scared to start because it's a reality, it can happen. You can be scared. Start with things that you are comfortable with. For example, going for a walk with your family or with your friends, just enjoying the outside while exercising. And I think it's always good to at least start with an exercise physiologist to supervise what you are doing and to give you some advices on if you should do this exercise or that exercise, and should always be aware of what are the condition you are in. And if you have any other questions, I am here for addressing them, even in the email that I provided.
Okay. Thank you so much, Anna. That was a very useful and informative presentation. And I think one of the biggest takeaways, at least for me, was more than fulfilling the recommendation is avoiding inactivity and being as physically active as possible. And I think that's very important for our patients. Thank you for taking time to do this presentation for us. And thank you for patiently answering all of the questions. And for all of the attendees, if there are any questions that you would still want to ask, please feel free to send us an email and we will make sure that Anna responds to your questions. And the recording from this webinar will be available by end of this week on our website and social media pages. So thank you all so much for attending, and thank you so much, Anna, once again.
Thank you so
Have a
much.
nice evening.
Have a nice evening.